Hello and good day. My name is Hannah Ballesteros, here to present to you my Sentinel events. The purpose of this presentation is to explain what a Sentinel event is and to give two examples of it. According to the Joint Commission, a Sentinel event is a patient safety event that results in death, permanent harm, or severe temporary harm. Sentinel events are debilitating to both the patients, their families, and healthcare providers involved in this event. The first Sentinel event is about the man who did not take his prescribed Lasix correctly. Nurse, I need help. I brought my dad here today. He's right there by the chair. He's currently not himself. I ask him simple questions. He can't seem to answer them. I also noticed that his hands and legs are really swollen, and he's been complaining of difficulty breathing. Please help. I don't know what to do. I visited him today and I don't know, he seemed like he's in distress, but he's unable to tell me because he's not himself today. Where are we? Okay, I can help. Let me take his vitals first. I'll check him in, and let me go see what the doctor will say, okay? Have a seat. Doctor, hi. I have Mr. M here, a 66-year-old man who came to the ER with dyspnea, auscultated crackles on bilateral lungs, and 2+ splitting edema on bilateral upper extremities and bilateral lower extremities. He also presents with slight confusion and needs cues to be reoriented. According to our records, he has a diagnosis of congestive heart failure, CKD, and was just hospitalized about a month ago for having an acute liver failure. According to our records as well, it says he has a history of drinking alcohol almost every week. I've interviewed the daughter, and she said that her dad has been taking the Lasix that was prescribed by the primary physician. He is currently on 20 milligram of Lasix PO, 1 tab daily, but according to the daughter, he would forget to take it on some days, so he would double the medication the next day every time he remembers that he forgot to take it the day before. On some days, she also said that her father would mistakenly take 2 tablets because he does not remember if he took the medicine yesterday or the day before or not. She also said that she frequently visits her dad, and today he just really doesn't seem like himself. He was having a hard time breathing, and that's what prompted them to come to the ER. Also, Doc, the daughter brought the bottle of the Lasix. It's currently empty, but the date on the label says that he is not due for a refill for another 2 weeks. I confirmed that with our records, and it's true, he's not due for a refill for another 2 weeks. Narrator Hannah here. So after informing the doctor about what's been going on, and after data was collected, pretty much the nurse made a conclusion that the patient ran out of Lasix a few days ago, and the patient has not gotten his daily prescribed dose during those days. The patient is currently experiencing hypervolemia. Hypervolemia is a condition in which there is too much fluid in the body related to not taking the correct Lasix or correct Lasix dose, as evidenced by the crackles and dyspnea that this patient is having. Okay, I've seen the patient, and please give Lasix 20 milligram IV push and monitor their output. Also, after the first dose, report if there's any significant changes. Get CBC and BMP as well. Okay. Update me on what's going on. Monitor him closely, especially his output. And I'll continue to give you orders. Just keep checking the system, okay? So for this patient, after the order was given, a urinary catheter was placed to closely monitor his output while he's still having some signs of confusion. The patient stayed in the ER for a few more hours, and he stayed there until he showed no signs of confusion anymore. And the physician wanted to continue monitoring him, so he was monitored overnight and was moved to med-surg floor. The doctor did order to run labs tomorrow morning and also to check on his electrolyte imbalances if there's any. With this Sentinel event, this could have been prevented if the patient and his family member or caregiver received correct education regarding the new medication he was prescribed. For this patient, a telephone follow-up care could have been done, as well as to check up on the patient's well-being, since it seems like he lives on his own. If proper patient teaching and continuous monitoring for this patient was done, it could have prevented the patient from having a Sentinel event. Okay, so for the second Sentinel event, second example, I won't do a scene scenario, kind of like the first one. This is a story, so I'll tell you the story. This is titled, "The Nurse Who Gave the Wrong Medication." A patient was being taken care of in an acute care hospital. The doctor ordered for a full body scan at the radiology department. The patient expressed feelings of claustrophobic and began to have anxiety and fear. The nurse who was taking care of the patient at the time talked to the physician and told the physician that the patient is nervous and having fears of being in confined spaces. So the nurse was doing her job. She advocated for the patient. So the physician then gave an order for Versed. Okay, midazolam or Versed is used to produce sleepiness or drowsiness and relieve anxiety before surgery or certain procedures. So when the nurse went to pull the medication from the medication dispensing device, the nurse then typed the first two letters, VE, which is the first two letters of the medication Versed. The medication dispensing machine or device populated the search results with the medications that has those first two letters. Routinely, the nurse selected the first on the list and grabbed that medication. She didn't look. She just clicked the first one, grabbed what was there, what opened for her. So that medication happens to be vecuronium instead of Versed. Now, vecuronium, or this medicine, is a paralyzing agent that leads to skeletal muscle paralysis and paralysis of the diaphragm for patients who needs to be intubated. So this medication is used for that. When the medication was administered, the patient is currently completely awake, can feel the pain, she's alert, and she's experiencing the discomfort, but she cannot move or breathe to fully express these concerns. The patient still went on the full body scan, of course. So they went on with that. After that, the radiology tech and the care team went to check to prepare and take the patient back to the room. Right? So they found the patient pulseless and not breathing. A code was called, of course, unable to retrieve the patient back to prior state. Life support measures were implemented. A few days later, the life support measures were withdrawn. The patient ultimately died. This Sentinel event of having a medication error led the patient into dying. This incident actually happened in real life, and it is not the first time. This Sentinel event is one of the absolute worst things that can happen to a registered nurse. This could have been prevented if the nurse was double checking or rereading the medication while dispensing it or typing it in the computer, and actively looking at what she grabbed after opening the dispensing machine. This medication could have also been prevented if the working environment had less distractions. So it was said on the article that there was a lot going on before this happened. So to move on with my presentation, Sentinel events are events that must be avoided from happening. Sentinel events can be linked back to these three things. First one is knowledge. You have to know what you are doing and why you are doing it in order to perform the task correctly and without harm. Also, in order to achieve expected outcomes. Second one is your work conditions or unsafe situations. For this one, the nurse must know how to do their jobs under pressure. Work conditions can pose as a barrier to a nurse who is trying to do their job safely and effectively. Distractions or anything that can lead to patient harm should be avoided. The third one, complacency. It is a direct result of doing something over and over again to the point that you've become comfortable doing it. Because of that, you begin to cut corners and skip important steps in order to provide safe care. One simple example is when you don't check your patient's armband before administering a medication. Another example is just like the second Sentinel event. The label was not reread before administering the medication. So, understanding those three things should help nurses understand how to prevent a Sentinel event from happening. That concludes my presentation.